Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster, and today we're exploring how insufficient vitamin K2 silently accelerates brain aging by stifling neuron growth and amplifying inflammation. Together, Ilara and I will clarify the science and outline practical steps to safeguard cognitive health.
Thanks, Ethan. Vitamin K's reputation for blood clotting overshadows its deeper roles. In the brain, the K2 form, particularly MK4 and MK7, helps build new neurons, stabilizes cell membranes, and reins in microglial overactivity. When intake falls short, memory fades faster, and the risk of neurodegenerative disease climbs.
Many Western diets underdeliver on K2 because processed foods crowd out grass-fed animal products and fermented dishes. Surveys show older adults consume far below the levels needed for optimal neuroprotection, yet standard lab panels rarely flag the problem since they focus on K1-related clotting metrics.
That disconnect matters. The recent 6-month mouse study in the Journal of Nutrition illustrates the consequences. Animals fed a vitamin K-restricted diet displayed poorer object recognition scores, took longer to solve spatial tasks, and showed markedly lower MK4 concentrations in brain tissue compared with controls receiving adequate K.
Those biochemical findings are striking. Activated microglia levels soared in deficient mice, signaling chronic neuroinflammation. Simultaneously, the hippocampus, the seat of learning and memory, generated far fewer immature neurons. Together, these shifts undermine the brain's resilience to everyday challenges and accelerate cognitive decline.
The takeaway is straightforward. K2 supports the brain on two major fronts, fueling neurogenesis and keeping inflammatory cascades in check. Without it, the brain ages faster at a cellular level. That reality highlights why older adults struggling with memory or brain fog should examine K2 status closely.
Let's contrast K1 and K2 so listeners grasp why K2 deserves special focus. K1, dominant in leafy greens, handles clotting. K2, abundant in pastured yolks, organ meats, certain cheeses, and fermented foods, directs calcium into bones and away from arteries while prolonging availability in the bloodstream.
Moreover, MK7 stays active for hours, giving bones, vessels, and neurons sustained protection. Neglecting K2 leaves calcium free to lodge in arterial walls and starves the brain of a nutrient that preserves synaptic plasticity. It's a silent setup for both cardiovascular and cognitive problems.
People taking statins or dealing with osteoporosis, atherosclerosis, or diabetes should be especially vigilant. These conditions often coincide with low K2. Yet, because clotting tests remain normal, the deficiency may go unnoticed until subtle cognitive slips or vascular stiffness appear.
Food first is the best strategy. Grass-fed egg yolks, liver, tallow, and butter naturally concentrate K2. Cheeses like Gouda and Brie, produced with traditional animal rennet, add meaningful MK7. Natto, though an acquired taste, offers the highest MK7 concentration known. Small servings make a big impact.
Pairing K2-rich foods with healthy fats boosts absorption, since K2 is fat-soluble. Including magnesium and vitamin D3 further optimizes calcium placement. A widely cited guideline is 180 micrograms of MK7 per 5,000 IU of vitamin D3 for adults, barring interactions with anticoagulant medications.
Supplements can backstop dietary gaps, but quality matters. Choose formulations with bioavailable MK7 and avoid vegetable oil carriers high in linoleic acid. Always review medications first. Anyone on vitamin K antagonists requires clinical guidance before starting MK7.
Listeners often ask how quickly benefits appear after improving K2 intake. While arteries and bone density shift slowly, cognitive gains such as sharper recall or a steadier focus may emerge within weeks as neuroinflammation subsides and neural membrane health rebounds.
Consistency underpins lasting results. Incorporate K2 sources daily. Scrambled pasture-raised yolks at breakfast, a slice of raw milk Gouda at lunch, grass-fed liver once or twice weekly, and occasional natto. Such habits gradually rebuild MK4 stores in brain tissue and restore youthful neuronal turnover.
It's worth emphasizing that K2 does not act in isolation. Adequate omega-3 fats, B vitamins, and antioxidants further shield neurons. Yet, K2 remains the overlooked linchpin that ensures calcium, and by extension, cellular signaling, stays where it supports function rather than triggers damage.
Agreed. When calcium deposits in arteries stiffen vessels, cerebral blood flow declines, starving neurons of oxygen and nutrients. By steering calcium back into bone, K2 preserves vascular flexibility and indirectly sustains brain perfusion, a crucial factor in aging well.
For those tracking progress, biomarkers beyond clotting are emerging. Undercarboxylated osteocalcin and matrix GLA protein levels hint at systemic K2 status, though interpretation is still evolving. Practical signs, stronger nails, fewer bruises, steadier memory, often tell the day-to-day story.
Ultimately, prevention beats remediation. Waiting for cognitive symptoms allows inflammatory cycles to entrench. By prioritizing K2 early, ideally long before retirement years, listeners build neural reserve and reduce susceptibility to Alzheimer's and related disorders.
Let's close with an action checklist. First, audit your diet. Are grass-fed yolks, organ meats, or traditional cheeses regular staples? Second, experiment with a tablespoon of natto twice weekly, or integrate MK7 supplements if whole food sources are scarce.
Third, pair K2 intake with vitamin D3 and magnesium. Fourth, minimize refined seed oils that compete with K2's benefits. Fifth, discuss any anticoagulant therapy with a clinician before adjusting K-related nutrients. Implementing these 5 steps fortifies cognitive capacity for decades to come.
I appreciate how today's discussion shifted beyond mere Q&A to a cooperative review of the evidence and its practical implications. Listeners now have a clearer path to bolster brain resilience through something as accessible as vitamin K2.
Absolutely. The message is empowering. Strategic food choices and mindful supplementation can restore a nutrient deficiency that quietly erodes memory and mental agility. Taking action now means arriving at older age with sharper cognition and healthier arteries.
That concludes this episode of Dr. Mercola's Cellular Wisdom. Review your pantry, make intentional swaps, and observe how memory and focus respond.
Thank you for tuning in. Stay proactive, stay nutrient aware, and join us next time as we continue translating cellular science into everyday strategies for vibrant health.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.